Welcome back. We all know that if we lift something that's too heavy, we're going to have back pain, right? But certain kinds of back pain could be a symptom of something more serious than a pulled muscle. Joining me now to explain is Dr. Paul Lynch and Tory McJunkin from Arizona Pain Specialists, along with their patient, Dan Foley. Thank you all for being here. It's good to see you all again. First of all, tell us about what you do.
Thank you for having us on again,
Absolutely.
Lisa. I'm Dr. McJunkin, and this is my partner, Dr. Lynch. Both of us are interventional pain management doctors, and so we deal with things not so serious like a pulled muscle, all the way up to something like a vertebral compression fracture like Dan has that we'll talk about later. Each of us have done specialized training in pain management to deal with each one of those specific situations.
Now, Dan, your situation is a little unusual because you're so young. You see more of these fractures with older folks. Tell us what happened.
Well, I was actually out on a weekend trip with some friends, and we were at the dunes.
Okay.
And yeah, I was on a quad, and I broke the cardinal rule of coming over a hill, and I thought it was a plateau, but it was actually about a 15-foot drop. And I was sitting down, so when I landed, all the energy went through my spine and actually blew out, for lack of a better word, my L1 vertebrae. And I thought it was a compression sprain, and it was really painful, like somebody hit you in the back with a pipe. So I just laid there for about 20, 30 minutes until I could actually get up, and then I called a friend and said, you know, you probably should get it checked out, make sure it's not a fracture. So I did the next day and found out I actually did blow out the vertebrae, a wedge fracture they call it, where it broke out like that.
Ooh.
And I called Dr. Lynch, and he talked about a few options, and one of them was the vertebroplasty, which was a little bit unusual for a guy like me because it's usually for older ladies who have osteoporosis and maybe have had a fracture there. Mine was a sudden injury, and it seemed to fill the bill. So we went ahead, and it worked out very well.
Okay, I have no idea what that procedure is. So tell us what it is, Dr. Lynch. I can't even pronounce it.
Thanks. You know, one of the reasons we want to do this show on this, pathology is compression fractures are so much more common than people realize. Between 700,000 and 800,000 Americans will get a compression fracture every year. And it's not always such a dramatic event like quadding, in sand dunes. It's usually a 65 to 80-year-old female who reaches over to pick up, a gallon of milk, and they feel some pain in their back, and they don't even always know they had a fracture. I mean, Dan laid on the ground for 25 or 30 minutes, not being able to move. But sometimes it's a lot more subtle. So when he came to me, we did an MRI when we saw he did have a wedge compression fracture of probably the most important bone of his body, L1. And so we talked about options, which would be bracing, taking it easy for a while. But in the end, I recommended to him we should probably go ahead and fix it because it was really interrupting his day-to-day life. He wasn't able to do the stuff. He wasn't able to exercise. So we went forward with a compression fracture repair called a vertebroplasty. And what we do is we take a very small needle under x-ray guidance. We place it into the bone. There's a model here of it.
Okay.
Yeah. So we take a very small needle, we place it into the bone that's fractured, and then we fill it with a cement. And all it really takes is 3 or 4 cc's of cement. It'll harden, and then the bone will stop moving. It immediately treats the pain. Most patients go home within an hour or two of the procedure, and the pain's gone.
Okay, and obviously you're not using real cement. You're using something else, I'm assuming.
It's called polymethyl methacrylate, but at the end of the day, it's kind of like a bone cement.
Wow, and how did you feel right after? Did you notice a relief?
Oh, yeah.
Really?
It was really just a fairly short stay at the hospital. I was in and out the same day. I was sore, obviously, because there was some work on the tissue around it, but the next day I noticed a big difference. And within a few days, the pain was pretty much gone. I was really surprised how quickly it worked. And it's been about 8 months now, and did a little bit of physical therapy, and I feel like I'm about at 100%.
Wow, that's amazing, because you hear people who pull their back who are in pain for the next 20 years and never feel ease, and here you are, had a major problem, and you were able to make him feel better so quickly. And the traditional methods, he probably would have had a lot longer recovery,
That's
right?
right.
Yeah.
That's right. And what's exciting about this procedure is the first one ever done in the world was in 1984, and it didn't come to the United States until 1997. So it's very new. But the reason we're doing them is new research has shown that someone who gets a fracture, there's between 22 and 34% chance that they'll die in the next year. And a lot of that is because it's happening to 75, 76-year-old females but it really does affect your lifestyle. A lot of what'll typically happen is you have a 77-year-old lady, she'll reach over, she'll feel some pain, and then for 2 or 3 weeks she's in bed, she's not getting out of bed. That really leads to other problems. And we always knew like breaking your hip was really a risky thing to happen.
Yeah.
But we're finding out that even a small fracture in your spine, it gives you a lot of risk. And so what we're doing now is we're trying to, first of all, educate the public and tell people about it. But second, be able to fix these fractures when they happen, and then educate people about how not to get another fracture, including treatment, diet changes and that stuff.
Or doing crazy things like quadding and dropping down.
Yeah, my wife made me sell the quad, so.
That would be a good way to avoid back pain. But sometimes it's unavoidable. Sometimes it's, like you said, the craziest thing, reaching down, and things can happen.
That's exactly right.
So the best part is, though, you're feeling great now, and you can help so many other folks who might be having. And I asked kind of a dumb question, but it really isn't. If you're somebody who you might be suffering from this and you might not realize you actually have it, it is possible, correct?
Oh, definitely.
Levels of pain are different.
Definitely. So we see that very commonly, actually. People coming into the office and they complain of back pain.
Right.
We have to get an imaging study, and we will see a fracture on the MRI typically. And then we can tell the person, we think your pain is coming right from this level. There's a treatment that you go home the same day, just like Dan had, and you can get excellent pain relief, and it might be something that takes away your pain forever. So it's an amazing, amazing thing that we're doing for people now that really, really helps them.
Absolutely, because back pain, I'll tell you, like you said, once you get it, it changes your life. You do a lot less and so forth. Thank you both for joining us, and thank you for sharing your story, Dan.
You're welcome.
Very good information. And if you do want more information about Arizona Pain Specialists, you can visit them on the web at arizonapain.com. There's the phone number right there on your screen. And also, coming up, if you want more information about a seminar that you're holding, here's the information on that. It's Saturday, November 15th.
Exactly.
There are the times over at the Hilton Garden Inn, and you can call your information for more information on the seminar to help folks get educated, especially with back pain. It seems like more and more folks are suffering from that.
That's right.
Thank you both again. Good to
Thank
see
you,
you.
Lisa.
Thanks, Dan.